Yes, I'm ready.
Okay, good.
Okay. Good evening, everybody. Welcome to the Board of Health meeting, January 9th at 6:35 p.m. Call meeting to order. Roll call. Are we doing a roll call now? Darlene, it says roll call. Are we doing a roll
I'm
call?
sorry. Ms. Ortiz?
Present.
Ms. Carmen?
Here.
Dr. McGuire? Here. Ms. Altough?
Here.
Mr. Clark?
Here.
Mr. Bellotti?
Here.
Dr. Ansler?
Present.
Ms. Gavin?
Present. Are we in right order? Is that the way it goes? I'm just,
No public comment.
there's no public comment tonight?
Yeah.
Okay.
Got a different one tonight.
What?
Pretty agenda.
Oh, you know what? This is planning and development. How did I get that one?
Oh, you must have, here, do you have an extra agenda?
I can pull.
You picked it up outside,
I
didn't
did.
you? Yep, that's where you got it.
Yes.
We're in the wrong room.
We're in the wrong room. I came in that room and everything.
I haven't had Corey back there.
Good thing.
There you go.
All right, there we are, public comment. I knew we were out of order. That's the way it was in the planning and development. Thought I had the other way around. Okay, all right. Item number 3, we need to approve the minutes. Do we have a motion to approve September 23rd, 2020 minutes?
Madam President, I move that we approve the minutes from September 23rd, 2020.
Any corrections or adjustments? Do you have a motion, second?
I'll second it.
Darlene?
Okay. Ms. Altough?
Do I get to vote?
Yeah.
Yes.
Welcome, I
Yes.
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 I'm sorry. I didn't
Sorry.
hear you. Mr. Clark?
Yes.
Ms. Carmen?
Yes.
Dr. Ansler?
I'm going to abstain as I was not present at the meeting.
Okay. Dr. McGuire?
Yes.
Ms. Ortiz?
I was not present at the meeting, I'll abstain.
Minutes you can.
Mr. Bellotti?
Yeah.
Ms. Gaffney?
Yes. I received some information that we can just do these by voice vote, so we'll
Okay.
just go ahead and do, we have a motion to approve September 26th minutes.
Madam President, I move that we approve the minutes of the Board of Health meeting, regular meeting from September 26, 2022.
Do you have a second?
Second.
Thank you. All in favor?
Aye.
Opposed? Thank you. We need a motion to approve November 21st, 2022.
Madam President, I move that we approve the minutes from November 21st, 2022, regular meeting of the
Thank you.
Board of Health.
Thank you. Dr.
I'll
Amper,
second it.
seconds. Any discussions and corrections? All in favor?
Aye.
Opposed? And we have a couple of employee recognitions tonight. We have one person here. Is anyone online with us, Heather or Janelle?
If they may be listening, but they're not on the
Okay,
list.
all right. All right, well, let's do them all, 3 of them. Did the department heads here for them?
Mhm. That's exactly what she was.
Mary Ellen, do you want to read it off and just say something?
Sure. So the first one that I have is 10 years of dedicated service and commitment to public health for Janelle Carlson. She's been with us 10 years. She has worked as a kennel technician. She has worked as an animal control officer. She went back to work as a kennel technician. She went to become our lead for our animal control officers, and now she is the assistant manager for field operations. And she has done a fantastic job. I'm so happy that she decided that it was time for her to move up, and I'm just really pleased and excited for her 10-year anniversary for her. So.
Congratulations, thank you.
My other employee is kind of the same news. Heather Kavitera has been with us also for 10 years, so she had her anniversary at the beginning of the month. She has worked in our office, both as an administrative specialist, and then she moved into our administrative coordinator. So she was the one who does all your data for you. She does all the monthly reports, all the annual reports, all the reports that I need to get any of our licensing or certifications. And then last spring, she moved into our kennel, so she is now the assistant manager for kennel operations. And she too is doing a fantastic job. I'm very pleased with her in that position. She also runs, of course, running the kennel. She's running all intake animals, dispositions of animals, all the surgical units, and all the supplies and vaccinations that we need for those. So she also has been doing a fantastic job, and I'm very pleased to have her. in
Great,
that
thank you
position.
so much.
And Chrissy, you want to come on up?
Chrissy Watson, 15 years. She started out as she's a health educator. She was in a community health program. She also is in family case management for a while. She, during the pandemic, stepped into a leadership role, and we started a new program for health equity and resource. And Chrissy has taken that charge and really is developing that program that's extremely vital to our public health. She also has been managing the MRC volunteers even before taking this responsibility on, and has grown that program. And you'll probably hear a little bit more about that because we just got some additional money that she has successfully applied for. So we're very proud of Chrissy. 15 years. Thank you.
Oh, did you want to get up there and get a picture too? As the public health administrator?
Chrissy, would you like it? I feel like it's not the best day, but I am happy to stand up with Chrissy.
That would be great.
Okay.
Please.
Susan, you want to go back up
You're
again?
required, apparently, you know, to take a picture. So, yay.
Everyone's here? All right, cool.
Any other figure
Right.
she's
Thank you, Chrissy. Well done. So we have division updates, department division updates. Melissa, do you want to do yours as well as finance?
Sure. I will be short and sweet. Okay, so just a couple of updates. I think it was the November finance committee meeting asked us to get staff input on the proposed ARPA project. So we actually have 4 meetings scheduled this month, in-person meetings where we're going to sit down with staff, get their input, and then bring that information back to you. We have 2 this week, 1 next week, and then 1 the following week. So I would assume we'll schedule a meeting in February to review that information and share that with the committee, and then seek the committee's guidance on what direction you want us to take from there. Last Thursday, after the Public Health and Community Services Committee, we did a tour with that new committee at the county level. So we had, I think, 4 county board members participate. A few others were not available, but they may reach out. So that was fun. We went around to each of the divisions, including Crystal Lake. So we toured the whole kit and caboodle. A couple of things that to be aware of. So the CFO for the county, Kevin Bueso, has resigned. He's moving on to another exciting position. So he'll be replaced by Carrie Weiss, who has been his assistant. So she'll step into the CFO role starting, I think, at the very end of the month. And Ann is going to speak to, there's a new state law that's getting effective as of January 1st regarding bereavement that she'll give you a little more information on. That's impacting personnel policies at the county level. And we are also going to be, we were invited last year and the year before, I think, to participate in the county strategic planning process. So that's getting up and running again. That starts this week, and we will also be participating in that. As far as the financials, you have just December, so you have the first month of this fiscal year. November is in the process of being audited. Those numbers, so the county has several months to finalize those numbers, so we'll bring that back. Usually, we bring that to you as our unaudited financial report. So you just have the December for this fiscal year. Nothing really outstanding to report on that. I have both TB and the health, Department 51, which we say is the health department, and Department 5200, although I think on the report it says 24 on your agenda, Department 24 for TB. So primarily we have, let me pull that here again. For the health one, we have all of our disbursements that have hit D365. Payroll is estimated. It hasn't all been posted by the county. As a reminder, the county posts payroll into D365. So those numbers are just an estimate, and then they'll get updated as we go along once it's been booked. And then we have our vaccine inventory estimate. So for the first month of the fiscal year, we had $173,075.86 in income and $462,740.88 in expenses. I am happy to answer any questions. It was because of the holidays, there's probably still going to be expenses that hit December and get pushed back. So remember, D365 is continuously being updated as things are posted back to a prior month if they haven't cleared.
Thank you. Any questions for Melissa? I apologize, I'm remiss of not introducing our newest
Oh, yes.
board
Oh, my gosh.
liaison.
We have
I was
two.
hoping I'd fly under the radar for a little while longer.
Yes, actually, we have two new board
Yes.
members here.
So we'll start with the county board liaison.
Okay.
If anyone doesn't know who she is, this is Pamela Alfeld. Do you want
Good
to,
evening.
do you want to tell us a little bit about yourself? And
I have served on the county board one full term of 4 years. Prior to that, I had a lot of other political experience at different levels of government and public health. I got my leadership training originally from a public health institute, so that's where I got a lot of the background. So it's kind of nice to be home and back where my interests started. Really, really a pleasure to be here.
Well,
Looking
welcome.
forward to it. Thank you.
and anytime you want to just jump in, we're kind of a really welcoming group of people. And
She's lying.
but I do it well, don't I? And next,
Convincingly.
Guadalupe, who goes by Lupe,
yeah.
Lupe.
Ortiz.
Either one is fine. I am currently have the honor to be the executive director of Youth and Family Center of McHenry County, one of our non-for-profits here in McHenry County, in the city of McHenry, serving anyone in McHenry County. I have 6 years in that role, which is sounds crazy to say, but prior to that, I worked at Pioneer Center as a community support specialist, so I have about a little over 10 years of experience working hands-on with McHenry County residents as a service provider, which also sounds crazy to say. And then over 30 years of living in McHenry County. I was not born here, but I was raised here in Woodstock. The city of Woodstock is where I grew up in, and I'm really honored to be here. What brought me here was super inspired about the Healthy Community Study and all of the useful information that those studies that do for us, but then also digging in a little bit more and working with all these wonderful people and how we can interpret that information and get more people involved. And I think my expertise in non-for-profit will be a great fit for public health.
Well, welcome. And you know what? Because you're new, just everyone go around real quick and just say a little bit about yourself.
I'm Kristen McGuire. Welcome. This is my second year. Is this my second year?
At least.
That sounds good. Yeah, this is we'll say second year on the board, and it's a great group to be involved in, and I'm glad you're here. Thank you for coming aboard. Thank you.
My name is Joe Clark. I live in Marengo, out in the rural area. I'm a farmer, and before that I was a firefighter.
Hi, I'm Cecilia Carmen. I'm a nurse. I live in Lake in the Hills, and I'm glad you're here.
Cindy Gaffney, I live in Marengo. I'm a sales rep for a large plastics company, and I also run a non-for-profit animal services and assistance programs.
My name is Jay. I'm just a small business owner. I'm just glad that you guys are also becoming a part of this community. This is a place to be when learning about especially health and working with Cindy. I have learned so many things. I've been here, 6 months now? I think this is my first year. I have to admit, I did not know what went around as far as these guys, what they do sitting behind the doors, So welcome aboard.
I'm Barb Amsler. I'm a retired physician. I live in the Huntley area. My practice was in Algonquin. And I am in my first year, I think 9 months or so of being on the board. And I want to welcome you and the Pamela.
You're gonna get payback for that. I already introduced myself.
Oh,
So you have, some
Yeah,
of
I have the staff,
Yeah.
the staff too, yeah.
My name is Melissa Machado. I'm administrative assistant with the Department of Health, and I've been with the Health Department for going on 4 months, and I enjoy being here.
I'm Darlene Mallett. I'm also administrative assistant with the Health Department. We both actually do Board of Health meetings and getting things set up. And we work in vital records also.
We'll go over through with the directors.
Hi, Mary Ellen Howell, and I run the veterinary division for the department.
Hi, I'm Patty Noem. I'm the Director of Environmental Health.
Ann Marin, Director of Planning and Operations.
Susan Karras, Director of Public Health.
And then I think we will meet some of the other staff here this evening. We'll be doing some presentations. If you would like to take the opportunity to introduce yourselves. Well, Chrissy,
Chrissy Watson, I'm the Community Resource and Equity Coordinator. I'm fortunate to work on some coalitions with WIPE, so it's exciting to see her.
I'm Taylor Cerrone, I'm a health educator, and I work on overdose prevention and response. And I'm here to do the Narcan training tonight.
I'm Lisa Shack. I'm here.
Interested employee.
Deb.
I'm Deborah Dorn. I'm the staff development coordinator for McKinley County Department.
Lindsay Sabatelli, community information coordinator, and apparently I'm here to make everyone feel uncomfortable by taking photos tonight.
That is true. And then there is one more. We did have another new Board of Health member, Melissa Katz, who really wanted to be here, but she has gotten ill, and so she was not able to join us tonight, so we can introduce her formally.
Next go round. Thank you. All right, division updates. Director Karras, you want to go?
Sure. I'm just going to do a little bit of bragging. We have 2 employees, Kirsten Haley. She sat for the Certified Nurse Case Manager exam and passed it, so she is board certified through the American Nurse Association, so we're proud of that accomplishment. Jenna Wagner also applied to Herzing University for the nurse practitioner program and was accepted, and she is starting her classes this month, so we're very proud of her as well. I'm happy to report too that all respiratory illnesses are trending down, RSV, influenza, and COVID. We do remain in medium community level for COVID, so that is all coming down. We're hoping it stays down. So I also wanted to highlight the Narcan distribution program that Chrissy's group started with Taylor's assistance. All our frontline staff were trained, including Darlene, on handing out Narcan and giving that training, initial training. That we handed out in Woodstock 24 doses so far, in Crystal Lake we've handed out 15. So it has, and we put that information out or started that right before the holidays. So very proud of what they're doing and the lives that those doses could potentially save. Also wanted to update you that Ebola contact tracing from Uganda will be stopping tomorrow because that situation there is improving. So we're happy to report that. So good news tonight.
Thank you. Director Marin?
Thank you.
We are currently working with county finance, as Melissa kind of alluded to, on the year-end audits, getting them a lot of information from 2022 so that they could start closing that out and we can get our finals reported to you. We're also working with the county on the ARPA reporting for Q4. A lot of fun there. Had a very long meeting on responses today. We're working with the Bronner Group, who is a group that was hired by the county board to assist us in the reporting requirements for the federal government. We are also working on updating the personnel manual. Several new laws and changes to some county personnel policies have taken place in addition to us just doing kind of a yearly review. I know Melissa alluded to the new law effective January 1, 2023. The Illinois Family Bereavement
Thanks for using
Leave
WebEx.
Act.
Visit our website at www.webex.com.
This is a new law, again, effective January 1. It states that anyone who is FMLA eligible, they shall be entitled to a maximum of 2 weeks or 10 working days of unpaid leave within 60 days after the date of notice of death of a qualifying family member to manage arrangements, attend the funeral, and grieve. So employees may elect to substitute paid vacation, personal or sick or comp time, and using those days of leave. So the maximum allowable time for family bereavement leave within a 12-month period is 6 weeks. However, if you're going to do bereavement leave, you can use, FMLA, but it cannot surpass 12 weeks in combination with that. So if you are eligible as an employee, if you have worked for the county for at least 1 year and have worked at least 1,250 hours in the last 12 months. So we'll update the employee manual with all that current language on that. There was another county update. We are getting new badges and fobs and whatnot for all our doors and security. This is a very expensive system. The county update was that the cost to replace a lost ID badge will now be $70.
Oh, wow.
Wow. So that will be updated as well. We will add additional language pending any kind of bilingual discussion if that's appropriate. And also, we took out all union language as the union dissolved in October, so we no longer have a union within the department. We also sent out staff surveys on employee appreciation ideas and also training that they would like to see in 2023 outside of any mandated training that they currently have. So we're getting all that information together. Deb Dorn and I will be back in the meeting in February to report that out to you. And to remind everybody here, Open Meetings Act training, that is annual. You have to get on the Attorney General's website and take that training and get the certification. So if anybody needs any direction or links for the appointed officials, please shoot me an email, Deb an email, or Melissa, and we'll get that information to you.
We all have to take it.
Yeah.
That's annual?
Just send the link
It's
out.
annual.
Can you just send the link out to everybody?
Sure,
Yeah.
will do. And that's all I have.
Thank you.
I just have one question.
Sure.
Go ahead.
Oh, sorry.
Go ahead.
For the bereavement law, I thought it was for like if you have a miscarriage or loss of adoption.
That too. I mean,
okay.
it's a whole long
Oh,
list
long
of
list.
things
Okay,
that are
alrighty.
eligible for
Okay.
bereavement. So
Alright.
I just kind of condensed it.
Oh, okay,
But
all righty, I just want to make sure.
I can give you the full,
No, because I was reading it and I was just like, wait a second, is this the wrong law? But, okay,
No,
all
it's
right,
the same.
I'm good.
The Open Meetings Act training, is that, it's annual, but is that annual for new members?
I believe when, on the Attorney General's website, it said annually for elected and appointed.
For years, the website was down and there was, or maybe not years, but for a long time, the website was down, so you couldn't actually do the training.
I don't think I took it, or did you? Did you take it?
Well, I've taken it, yeah. But it was always my understanding, once you took it, you were good.
Now, on the
No.
FAQs, it said it's annual.
Okay.
So I'll
It
double
could be
check
changed,
as
it
well.
could be changed,
Yeah.
no, I
Then it would
will.
just be, what would it be actually, and then, Ms. Katz. So. It's annual.
Then the next one, you referenced the employee appreciation. Did the funds get approved in our budget?
Yes.
Yes, they're not currently reflected in D365, but I have an email from the county assuring me that it's been approved, and we have already placed some expenses against that. So we
Okay.
are going with, yes, it has been approved.
Okay, good. Great to hear.
Any other questions for Director Mayer?
And you had mentioned that the union dissolved. Was there a particular reason why it dissolved, or lack of interest, or?
A lack of interest and, you know, kind of they wrote a letter saying we want to dissolve, and the union kind of went, all right, bye. So really, yeah, that they weren't really getting any of the support I think that the employees felt. So it was very mutual and very quick and very painless, which is the beauty of it, so.
Thank you. Director Noel?
Okay, just a couple quick things. There are a couple new laws that went into effect January 1st that impact our food program. One is a particular permit that is now allowed for farmers markets. So we have had a long-standing process for issuing permits, but this would allow an individual farmer to get a permit under certain circumstances that would allow them to operate in the multiple farmers markets throughout the county. So we will be bringing back an ordinance change for fees to create the fee category for that. It's set actually by statute. And then there is another law that prohibits the use of latex gloves in restaurants moving forward, except in very specific circumstances. So although we're not the formal enforcement agency for that, we're in the restaurants and food operations very regularly, and then we'll communicate any issues to the Illinois Department of Public Health. We're preparing for our program reviews for our food, private sewage, and water that are required for our certification. There's a lot of documentation and files that we have to get together that then IDPH staff either will come here and review, but it's more likely they'll do it electronically, and we will send that information to them. We're doing a battery recycling program throughout the month of January, so we've already collected about 200 or 250 pounds of batteries. So if you have any alkaline batteries or button batteries, please feel free to bring them in. We're happy to have them. It is Radon Action Month, so we are offering our short-term radon test kits at $8, which is really a very, very economical price. So we have had quite a bit of interest in that over the last week or so. And then finally, I think most of you know we've had a lot of new staff over the last year or so, and so to continue our operations, we had limited their training and limited their responsibilities to certain areas so that we could, get our work done. But now we've started the process of getting everyone cross-trained and up to speed in all our program areas. So that will take time over the year here, but ultimately we will have a better opportunity then to respond to all types of complaints more efficiently. So that's all I have.
Thank you. Any questions?
Is there a pair of gloves that the restaurants can use?
They use nitrile gloves, I think.
Okay.
That's the common use.
Any other questions for Director Noel? Director Howell?
Thank you. So first, I just wanted to let you know that we've had a couple of positive labs back for canine influenza, specifically H3N2. And we're going to be setting out an educational piece tomorrow, just letting the public know that there have been some positive cases. The symptoms are very similar to any type of influenza. You're going to have a cough, runny nose, potential fever, low energy, loss of appetite. Where it becomes more severe for a dog is if it changes into pneumonia. So we have had a number of calls from veterinary offices in the area. Again, we'll send out our educational piece both to the veterinarians as well as some of our other partners, and then to the newspaper, I believe. So we really just want to get an educational piece out to let people know what's going on so they are more aware. There aren't a lot of cases of canine influenza in the area, but periodically there'll be an uptick in it. So I wanted to make sure you knew that. I'm happy to say, although you do not have our December data, because it's too difficult when the cutoff date was for this meeting for us to get you the December and make sure it was accurate. But we did have 22 adoptions in December, so that's a nice high number. I'm happy to say that our population is fairly low right now, and the animals that we do have, they're going to be pretty easily placed, so that's exciting for us. We have hired a few animal control officers. We have a couple more that are in the works. If you remember, we went from 5 animal control officers now to 7. Our animal control officers will be doing some kennel work. I have some responsibility in the kennel. which is pretty normal for animal controls for the officers to have that. And then also our office, we have one admin position left, which we'll be filling soon as well, and then a lead admin, which we've been doing some interviews for. So we should be pretty full house, I would say, within the next month here, yes, yes. So we're excited about that. And I will tell you that getting out of the union and having the pay increase has definitely brought on a whole new group of candidates. So we're very, very pleased with that. We still have 2 worldwide temporary employees that we're working with, and they are doing a lot of our data entry. We are almost caught up with all of our veterinary packets. A few still invoices that are lingering. That means that they have sold our tags, but they have a third party who pays their bills. So we have to go through the whole packet, which might be 200 or 300 tags, determine how much they owe us, and send it to the third party for pay. So we usually run about $15,000 to $20,000 with third party payables. And then the last thing is today we just determined our 4 spring clinics. So we'll have 2 clinics in June, no, sorry, 2 clinics in May and then 2 clinics in June for rabies vaccination and microchipping. So we are moving in the right direction.
Thank you. Any questions for Director Hull?
I have a couple of questions about the canine influenza. Is this a reportable?
Very good question. So it is not reportable to the states, but we do keep an eye on it, and we let the state know because there are certain entities that are licensed. And so we want the state to know if there's any difficulty with a certain entity, or we're seeing an uptick in the area, so that they and we can kind of monitor those things.
So veterinarians are not required to let you
They're
know
not
if
required.
they have a suspected case. Now, is there definitive testing?
There is, but it's not typically done. So you might be testing, just looking for a regular flu, but you're not going to necessarily be testing for that. Maybe you're looking for kennel cough, but you're not. It's an expensive test to do. So you're trying other things before you're determining you need to do that test. In this particular case, there was a more than one animal from the same place that was being tested.
And if your dog is mainly housebound, the contractivity of this disease is dog to dog?
Dog to dog. Very contagious, but dog to dog. So you're gonna, and that's part of the educational piece that'll go out, that you know, you need to be care of your dog parks, you need to be care of your when you might be kenneling your animal. You should be talking to your vet about what vaccinations they recommend for your situation and your animal and where your animal may be going.
And humans are not an intermediary here
There are
at
no
all?
cases of humans contracting, H3N2.
Thank you.
Yep.
Any other questions for Director Hall? All right, on to the consent agenda. Do we have a motion to approve the consent agenda?
Madam President, I would like to ask that item 6C1 be removed and voted on independently. And I'll explain that when we do it.
I don't think I have.
Remove that from the consent agenda, please.
Okay. Do we have a motion to approve the consent agenda without section 6C?
I'll make a motion to approve the consent agenda without the section 6.
Do you have a second?
Second.
Any discussion? Okay, Darlene?
Mr. Clark?
Yes.
Mr. Gallardi?
Yes.
Dr. McGuire?
Yes.
Dr. Hansel?
Who was that? That was me? Yes.
Ms. Altough?
Yes.
Ms. Carmen?
Yes.
Ms. Ortiz?
Yes.
Ms. Gaffney?
Yes. Okay, we wanted to entertain a motion to discuss 6C1.
One. Yeah, I will make the motion to approve the contract with Dr. Hafiz.
Irfan Hafiz.
I'll second it.
Okay. The reason I pulled that off the consent agenda is if I'm correct, this contract was last approved by the
Finance committee?
the
I mean
the TV board.
Okay.
And this is really the first time it's rolling into our jurisdiction, and instead of it being lumped in with the consent agenda, I felt that the board members needed to
Understand.
have an opportunity to vote independently on it. So,
I'm
yeah.
sorry, I was talking to Darlene about something else. Can you repeat the first part about what, I missed the part about why it was pulled, just so that if we need to correct any.
If I recall correctly, this contract was under the jurisdiction of the TV board previously, and now that they've been absorbed into us, this is the first.
This was voted on by this board last December.
Last year? Okay.
But that's okay, so yeah, so you're right, it would have fallen under the TB board originally, and then when that board got absorbed by the Board of Health, it is now a contract. So moving forward, if you need any additional clarification.
Moving forward, I would expect it to be
Okay.
part of the consent
Okay.
agenda.
Any further discussion? Do we have a second? I'm sorry.
I second it.
Okay, thank you. Any further discussion? Darlene?
Mr. Galati?
Yes.
Ms. Ortiz? Yes. Dr. Amsler?
Yes.
Dr. McGuire?
Yes.
Ms. Carmen?
Yes.
Mr. Clark?
Yes.
Ms. Alto?
Yes.
Ms. Gaffney?
Yes. Thank you. On to contracts and agreements. The first one is the Alta language testing agreement. Is that?
Yeah, so I think I apologize because I just noticed, we have contracts and agreements new, and then we have new and unfinished business. And I think the original intent was all of these would go under new and unfinished business or new contracts. So I'm going to let Susan talk about this one, but it is going to be contingent. It's a little out of order, I would say. We wanted it to come after the discussion of the resolution about the bilingual compensation.
Well, why don't we just?
Can we do that? I think it makes more sense to talk about the bilingual compensation.
Let's do that.
Because the contract is really dependent on that moving
That out.
forward.
Okay,
Yep.
that's fine. We'll make an adjustment to the agenda and move that to 9C. Okay, Susan, is this next one yours?
Yeah, this is actually a renewal as well. This is a contract that we have with Lake County Health Department for our VSC program because they have an FQHC. We have to have a memorandum of understanding to provide vaccines for children. The government blocks vaccines to underinsured clients. So we have to have this agreement with the FQHC in order to do that.
I'll make a motion to approve that MOU.
Second.
Thank you. Any further discussion? Darlene?
Do we have a second?
Yes.
It was Barb.
Dr.
Oh, I'm sorry.
Over here, the team.
Yeah, next to the Pamela.
Yes, I call you the doctor.
Ms. Carmen?
Yes.
Dr. Amsler?
Yes.
Ms. Alto?
Yes.
Ms. Ortiz?
Yes.
Dr. McGuire?
Yes.
Mr. Galati?
Yes.
Mr. Clark?
Yes.
Ms. Gaffney?
Yes. Program highlights? Would that be,
So we're doing solid waste plan first, and Patty is going to present on that, so I will here. Do you want me to just go to the side here? Or do you mind?
I can do it.
No, I don't mind.
Okay.
You just have to tell me every time.
Ms. Carmen?
Oh,
Yes, you should have it.
So I just wanted to provide a very brief kind of summary and update on the solid waste plan that we just updated in 2022. Solid waste planning is a mandated program for counties. It is mandated by the Illinois Solid Waste Planning and Recycling Act of 1988. And as part of that, it requires counties to create solid waste plans that are updated at least every 10 years. And so, although it is a county program, it is housed within the Division of Environmental Health, and it has been since April of 2008 when it was, the solid waste planning program was moved to Environmental Health from the Planning and Development Department.
And I think, as you know, McHenry County Solid Waste Manager, that's Kelly Beckman in our division. So in 2021, there was an amendment to the Solid Waste Planning and Recycling Act that required the IEPA to appoint a committee to increase landfill diversion rates. And so they worked together, they created a report, and as part of that report, they established an entirely new template for county solid waste plans. So our new plan follows this template, and it requires just these things listed here. We're required to look at our current plan, how well we did, types and volumes of waste, the infrastructure that we have, our waste generation, our existing programs, recommendations for new ones, public education campaigns, and then just a summary of those recommendations. So in this update, the state has changed the emphasis from recycling rates to diversion rates. And that is significant because diversion is simply, collecting and reusing and keeping these waste streams out of landfills, whereas recycling is really converting that waste into something else that is then a reusable material. So it's a much broader view of extending landfill life and diverting waste. So the state has set the diversion goals starting in 2025 at 40%, and over the next 10 years it will increase to 50%. And I am really very confident that we actually meet those goals. We have some challenges in the program. We're doing a lot of good things, but we have some challenges I'm going to talk about. But I feel very confident that when we put procedures in place to actually collect the accurate data, that we're meeting and exceeding those diversion goals. So as I said, the plan's updated every 10 years, and it's approved by the county board, which it was approved in November of 2022, and it is then must be accepted by the Illinois Environmental Protection Agency, and it has been sent to them. I actually don't think we'll receive a formal response for that, but they have acknowledged that they have received it and that it follows the template that is required. So in doing the plan update, we really did try to get some input from a lot of different places. Try to really make it be representative of county concerns in an effective document. So we worked with the Delta Institute, which is a solid waste consulting firm, and they looked at some of the technical aspects for us, like the landfill capacity, emerging technologies, solid waste legislation. We worked closely with our county solid waste advisory committee. We have really good representation from industry, education, our farming group, our water resources specialist, and they really offered some valuable input there. And then we worked closely with the Waste Reduction Committee of the Environmental Defenders of McHenry County. And their sustainability summit that they had in January of 2022 was really a very successful summit, but it also provided information that we were then able to incorporate into the plan to address some of the needs that were brought forward there. And then we did solicit comments from townships, municipalities, and did a press release soliciting comments from the public. So in terms of how we did with the last plan, we had 34 goals and objectives, and of those, we did a fairly good job with 28 of those. What we didn't get to was completing a waste composition study, which it was done on a statewide scale, and it's really very difficult to do. Quarterly municipal meetings, we could not garner support and interest in doing that from our municipalities. We had some discussions about a deconstruction ordinance, but that was not brought forward. And then we didn't have routine contact with the landfills. And overall in that plan, we had a recycling rate or a goal of 45%. And we averaged really just under 40% with a range of 33 to 46. So we exceeded the state minimum, but we really did not get consistently to where we wanted to be. And our second target goal was to reduce the pounds per capita per day of waste disposed by our residents to 3.5, just over 3.5, and really it averaged at almost twice that much at 6.91. So, still work to do. And this is just a graph of that, so you can see where we started was over 45%. And then we would see those fluctuations and got close again, but it really averaged in the high 30s. And one of the reasons that happens is we have a very good did you have a question?
I did, but you finish. Go ahead, finish the slide.
One of the reasons for that is we have a very good mechanism for collecting residential data, residential recycling data. We know where that is. But in the commercial sectors, the industrial, institutional, we do not. We have to rely on whether they provide it to us. So we had some in the past, some very large retailers that have active recycling programs, and they provided that information, then they stopped providing it. So I don't think the program stopped, I think our information train stopped, and therefore we couldn't really get that information. Go ahead, Pam, I'm sorry.
No, explain to me how this works, county municipal. Is the county responsible for the municipalities program?
We're not responsible for their individual programs, but we're responsible to have a countywide program that tries to bring them into that loop and work with them to kind of all towards a common goal. So in 2015, the Illinois Department of Commerce and Economic Opportunity and the Illinois Recycling Association partnered up and sponsored a waste composition study for the entire state. They did their best, I think. I think we know that up here in the northern part of the state, there's a lot more recycling opportunities than the southern part of the state and things like that, but they tried to get a representative evaluation of that. And what they found, and these were done at the municipal transfer station, waste transfer station, or at the landfill. So they were clearly past the point of recycling, right? So they were at their end disposal place. And so organics, paper, construction and demolition debris, and plastic. Those are the big four. And if we were to address those really successfully, that's 80 to almost 83% of the waste stream that they're seeing at those landfills. So those, and all these others are important, but the big four would be, organics, paper, construction, and plastic. So when we look at our diversion rates, we break it into waste sectors and then type of waste to be diverted. So we look at the residential numbers, the commercial industrial numbers, construction and demolition, and then on the other side of it, we look at traditional recycling, which is primarily, the paper, the plastic, the metals, the glass, then the non-traditional, which is everything else, textiles, pharmaceuticals, paint, et cetera, and then organics. So organics includes landscape waste, manure, and food waste, and there's a large interest in really tackling organics as a diverted waste. So as our assessment, I just gave you a list here of the things that we've done, I think, really well, what we have that are very positive. We have a very good infrastructure. We have good partnerships with a lot of people in the industry and the municipalities. We do have very good solid waste and recycling facilities either directly in or immediately adjacent to McHenry County that offers opportunities. Most of our populated areas are served by franchise solid waste services. Everyone has access to drug take-back programs. We have our advisory committee, which is very positive, the Waste Reduction Committee of the Environmental Defenders of McHenry County, which is extremely active, partners with us on all of our recycling events. A lot of opportunities through our townships and community partners. We have a good way of collecting our comprehensive residential data, and we've had 2 household hazardous waste collection events 2 years in a row after not having one for almost 10 years. So that's really been positive and well attended. And we are very active in our regional state organizations and partner well with our regional solid waste agencies. But our biggest asset that we have here in McHenry County is we have residents who are more than willing to participate as long as we provide them with those recycling opportunities. So those are all our positive. And here's some opportunities for improvement. We really need to work better on some of the partnerships in the more difficult sectors. So, residents are required to recycle, commercial facilities are not. We need to get to that point by creating partnerships and helping them to see the value and working with them to make it easier. We don't have any mechanism really to easily capture that commercial data, so we have to figure out how to do that and do it better. We have no real easy way to capture non-traditional recycler data. So, all of these places, waste to energy places, it could be our resale shops and things like that. All of that contributes really to those diversion rates. And I think really we're to the point where we need to knock on doors, we need to introduce ourselves, and we need to figure out a way to get, into that industry and work with them. The potential for a deconstruction ordinance with construction and demolition. We have a very large construction and demolition general waste one in Cary that receives a lot of construction and demolition debris and recycles it. I think we have potential to work with that and create, even maybe if we started with county-sponsored projects where a certain percentage of that waste must be then recycled or put back into the used again would be a very positive thing. I think we need to do a better job of marketing and promoting our solid waste successes and maybe some of the things we're not doing as well, but I think we can do that with a website enhancement. I think we need to focus our annual, our solid waste campaigns And we need to really focus on certain waste streams and really make sure our public is aware of how better to do that and what those opportunities are. Now, we are working on some funding and grant opportunities. Currently, we are working one that is available through the EPA, and we are trying to partner with the Environmental Defenders of McHenry County and the MCC Sustainability Program to do a 3-year educational and outreach program. And if we're able to get that funding, I think that would really move us forward light years in our program. And then just continually identifying barriers to recycling and diversion, some of which might be ordinance related. So for instance, our pollution control facility siting ordinance is very complex, very expensive process, and it's very possible, I think, that not all pollution control facilities are equal, because it was written really for landfills, and there are other pollution control facilities that might be valuable, you know, to the county. So we've created our goals and objectives around those challenges. Really, I won't read through these because they're really just reworking of those same things I just listed. But, you know, overall, I would say that we have a really good foundation. We've done some very positive things, and we have very successful recycling events, et cetera. But we need then now to take it to the next level, and we need to hit those harder to reach waste streams. And, you know, I think we will be able to do that over the next few weeks. So, could I answer any questions for anyone?
Is there any, I want to say gold star county that's doing where we want to get to that you're aware of?
Well, I think that there are some counties that are very successful. Kane and Lake come to my mind immediately. And a couple of things that they have, though, is in terms of funding, is they have active landfills, so that they do get tipping fees. So they have larger budgets to do that, you know, and that does make it easier to do some types of recycling. So I think that we need to continue to look at those funding opportunities, those alternatives, and then I think we've really maximized the funding that we do have, you know, to make some good things happen.
Is there, I mean, I know, what's the one on Route 14, the recycling station in just past Crystal Lake, that Cary? Algonquin Township. That's, I mean, do we have anything like that in the Woodstock area, and can we multiply that in other places? Because that seems to be a very good one.
Right, so some of those programs that are done by the townships, Nunda is one that has a very active one, McHenry, Algonquin, so they do reach a large number of residents by doing it. Some of that programming that was offered by the EPA previously is no longer available for new programs, you know what I mean, to start. So those are the 3 biggest ones, but they've been able to continue. So it's a complex process to put more in place, because it's oversight, it's being able to handle the waste that are dropped off that you don't want. They all have to have, you know, security and cameras and follow up, and they have a certain budget just to handle those wastes that they're not intended to take, but they have to. So there's potential to do that, but it would really require a concerted planning and some funding to be able to do it well.
Because you have to be a resident of that.
In those areas.
To get there.
Mm-hmm.
I know
Right.
a few people that,
Right, that's correct. That's
Maybe you touched on this, but I've always been baffled as to why schools, where there are thousands of motivated little children who learn about cycling, and why they don't participate in these programs. What are the barriers for things like schools?
Right, so I do think they participate in programs, and I think that there's a lot of interest in doing all types of programs, so I think they do some. We've had some programming in some of the schools, and then there's the McSeep program, which is about environmental education right in the schools, so they take it to the children. That's actually now housed, I think, within the Defenders, right, in planning and development. So those programs happen, but then I think some of the tougher ones are, you know, if we could make headway with food waste. In cafeterias, which is huge. Food waste is a big deal. And then, you know, if we were to take that out even from schools into our restaurants and other things, it would be very impactful.
It's time consuming. Yeah, and because there's an organization called 7 Generations Ahead, and they are looking for, they're trying to find schools in McHenry County to work on food waste. They do food waste stations, and we've done that before in some schools in Prairie Ridge. But it's really the lunchroom staff and the principal getting motivated.
Right. They
They did it the year before where they had the station where here's your compost, here's recycling, station set up, the kids ran it, it went great.
Interesting.
This year they won't do it.
I mean, my kids, they're
So-
still elementary, but they go to school with 900 kids combined K through 8, and they don't recycle anything.
Yeah.
The teachers bring home their own paper to recycle and their own residential bins, and it's kind of sad.
Yeah,
So I
so,
was just curious
yeah.
what,
Yeah, it's just getting people, getting
The
parents
organization,
and
the time
motivation, getting
side, yeah.
people to do it, yeah.
But those are the types of places we need to get involved
Yeah.
in, because I think, like you said, if we took them from 50% recycling from
Yeah.
nothing, I mean, think how much that would, mean
Yeah.
overall.
So what was the reason that they didn't do it this year?
They just don't want to.
just the coordinated
They're
effort.
just, just coordinating efforts,
So
Like,
even though it was a successful program the year before, there was no motivation to continue it?
Well, because there's a lot of different little things that happen, about, because, one thing is now in Illinois, there's that shared table, like you have to have now shared tables,
Yeah.
which has worked out really well, because even that one school in Prairie Ridge, they went from 70 bags of carrots to like 10 bags of carrots.
Right.
Yeah, and it was like a huge success. But what's happening now is that, because some of that, it's really the lunchroom staff being motivated and who's working there that day, and the head of the lunch wanting to do all to do all
prep
this.
and stuff.
Yeah. So-
Okay, I get it.
I would say
Yeah.
it's probably, I'm sure the school and everyone is short-staffed.
Yeah.
Yeah.
And
I'm
I
sure
think
that's
it's
priority
time,
too.
yeah, it requires a lot
Yeah.
of
So-
I feel like a lot of things fell off of the pandemic, and people are slowly putting
Yeah.
the extras back on, perhaps, I don't know.
Yeah, I mean, the shared tables helps a lot, so that does help a lot, and yeah, so if because, like I said, they're definitely looking for more schools in McHenry County, if your kids go to school, or if you are motivated to help with them, we really need help with that, and, and now we're trying to, as I'm part of the waste reduction team for the Defenders, and so we are trying to pilot, we're working with, some composting companies about doing a pilot program with, having, restaurants giving them the buckets and having a combined compost bin for them, because a lot of our waste haulers do not do curbside composting, which I wish that would be, like they have to recycle. It'd be nice if they would have to do the curbside composting, but it's just not feasible right now. There's just not enough spots for that, so.
But I think that is one of the opportunities, because the more franchise agreements we have,
Yeah.
and looking at some of the non-traditional recycling things such as organics, is really, if you have 7,000 people recycling organics, within a franchise agreement, that's more workable than individual here and then 3
Right.
streets over.
Yeah.
So we have opportunities.
Oh, yeah, definitely, yeah.
And you can
Yeah.
you can ask municipalities in their actual contracts.
Mhm.
Exactly.
You give extra points to people who offer the service.
Right,
May not be
yeah,
a-
yeah,
right?
because right now it's flood and LRS do Lake
Yeah.
Shore, but Groove does not, MDC does not,
Yeah.
so.
Also, I know I did some research in Madison, and at the feed kitchen up there, they have the recycle for organics and everything else. If there's any contamination, cross-contamination, it all gets tossed.
It's already
Yeah.
pitched,
Which
yeah.
is,
Mhm.
and I don't think there's enough incentive for the agencies that pick that up to make a difference. I mean, if they see something in there and they're like, oh,
yeah.
it's got a plastic bag full of plastic, we're not taking it, and then off it goes. So that's where we've got to fix that too.
Yes, and what you're talking about, contaminated recyclables is one of the biggest reasons to have recyclables actually dumped in with the waste as opposed to being recycled. So we've worked hard at trying to do better education with that, but there's more to be done.
Yeah.
Absolutely right.
Yeah, because I know that if you put, in any of the ones that here in Illinois, if you put your plastics in a plastic bag,
Yeah.
it goes to the landfill.
Right, yeah.
I don't think people know that.
I don't think they do
I
either.
don't think so either.
I mean, that's a big problem, because people are thinking they're doing a good thing and save it. So we collect ours in a plastic bag, and then we have garbage cans and dump it into the garbage can and put it out the curb.
Mhm.
But the bags are a problem, because they can't go through the cutters and things like that. And an IR scan for whatever's inside of that won't get scanned, so they don't want to deal with it. No one's going to sort it.
Right, when they get to the material recycling facility, the MRFs, that's where those plastic bags cause a lot of problems. They could have a machine down, for a whole day, trying to get a
Yeah.
plastic bag out, that's why.
Same thing with straws. I mean, you can't recycle straws, and unfortunately, and diapers are the biggest landfill. Any other questions for Matt?
Curiosity question. On curbside pickup,
Yes,
when rubbish is picked up,
yes.
it's either transported directly by the garbage truck to the landfill in, was it Winnebago or Oldham County? or it goes to a transfer station and is reloaded on the semis. And we see those going up and down the roads all the time, so it's, you know, it's a common sight to know that rubbish is moving to its final destination. Recycling, though, it gets picked up, and you never see any evidence after it's picked up. You don't see any glass trucks going up and down the road or plastic trucks going up.
Right, so it does go to the MRFs, and we don't have any in McHenry County. So as we do have one municipal solid waste transfer station in Crystal Lake.
Right.
And then the material recycling facilities are outside, where it's sorted and then where it is packed up. So I did actually go to the nearest one and did a tour of it to see really what they do there. And everything that Cindy's talking about are some of the challenges that they have, but that's where those go. Now, some of it also can go to the municipal solid waste transfer station, because they have on the floor, they can sort the recyclables from it. We do the inspections there, we've seen them do it, but again, it will come down to the contamination. So if they bring in a recycling truck and they make an estimation that there is a significant amount of municipal waste in there, they're gonna take that end loader and they're gonna push it over to the waste side, and that's where it's going to go. So it can go to the municipal transfer station, but a lot of it goes directly to the MRFs, and that's where it's sorted, and then also it goes out to all the different downstream recyclers.
And where is that MRFs, the closest
Yeah,
one?
I went to one in Lake County, and I don't think it was in Grays Lake, but I went to one in Lake County. I think Waste Management just built another one. I can't think of the exact location. So they are in the area. Certainly in our region, there are multiple ones. All of the larger waste haulers have one. It's not only their trucks that go there, but they do have them.
Okay.
There's one
And they won't like say, like, for like proprietary information, they don't really say like who their contracts are. So yeah, to tell you who gets their stuff, they're trying to keep that pretty private. Because I was in a meeting with one of them, and they were like, no, we don't really give that out, because they don't want other companies to hear, oh, wait, you can give your recycling to this company, I'm gonna, you know, outbid you, kind of thing. So it's hard to get that information.
Thank you.
Any other questions? Director, no? Thank you. All right, we're on to the Narcan training. Thank you.
I want to know if we all have to do the collection dance first. Nobody wants to dance.
I volunteered Joe.
Joe, take some heroin.
Oh, wait, is that last one? I left that.
Oh, they're, oh, wait.
Same with that.
Oh, that's fine.
Use this when you get into that, yeah. So that- No problem, when they wait.
Thank you. I think
We're on the bottom.
storage, yeah.
Oh, it's a nasal
Yeah.
spray.
Thank you.
Okay.
Thank you. Number 2. Always do it. There we go. Hand them off.
One extra box. Okay, so does everyone have a packet and a box of napkins? Okay. Didn't miss it.
Do you have an extra packet?
Yes. So my name is Taylor Cerrone, and I am a health educator. I do overdose prevention and response. And so part of that is we just started handing out Narcan at the Department of Health. Anyone can walk in, no appointment necessary, no questions asked, no identifying information. We don't take anyone's name. They can just come in, get trained, and leave with Narcan. And so we tried to make it as accessible as possible. And so currently we are handing out naloxone. Naloxone is the drug name, Narcan is the brand name, so this is not Narcan. Most people refer to it as Narcan because it is the most common brand that you will see. We have naloxone. It is the same dosage. They're both 4 milligrams. They look like this. These are some trainers, so I'm going to pass these around if you guys want to kind of feel exactly what it looks like. And so there's 2 of these in each box. They are inside of like a blister pack, so there's no way that you can like accidentally deploy it. So you'll see, like if you've ever watched someone responding, like a police officer, they rip the blister pack open and pull this out. And so you can just hold it like this and then up in the nose and push. So the packs that I gave you, you can just bang it on the table, they'll come back down.
Okay, I'll do it.
They stick, the trainers stick. So the actual sprays of Narcan are one and done, so you don't need it to come back down. So the trainers have a tendency to stick, so just bang it on the table if necessary.
Do you limit people who come to get the Narcan Kleenex?
Okay.
Do you limit how many boxes or how many doses that they can take with them if they come in?
So currently we're limiting it to 3, unless there's like extenuating circumstances. And that's just because we want to have enough for everyone that comes in. And so the packet that I gave each one of you, the second and third sheet are what we give to everyone with the Narcan. So the clients take those home with them. The first one is what I use, or whoever's doing the training. If you come to Woodstock, most of the time it will be me. If you come to Crystal Lake, it could be a variety of people that work down there, since I'm mostly in Woodstock. But I have trained a total of, I believe, 36 or 37 Department of Health employees to do this training to the public when they walk in. So we have somebody at all times that can train you. There's never a situation where there won't be somebody that can train. So I go down this list, and I'm just going to kind of train you guys the same way I would anybody that just walked in, so you can kind of get a feel for exactly the information that we are giving out, but also so that you guys know exactly how to respond to an opioid overdose. Some of you in private professions have probably witnessed an overdose before, or even had to give Narcan, but most people have not witnessed an overdose. But there is actually statistics now showing that you're more likely to have to respond to to come across somebody that is overdosing than you are to come across somebody who needs CPR. And that's just the statistics with the amount of overdoses we're having in the country now. Last year we surpassed 100,000 for the first time deaths in the country from overdoses. And if naloxone did not exist, obviously it would be much more than that. So naloxone is only going to work for an opioid overdose. That is something that a lot of people don't know. However, fentanyl is an opioid, and with the prevalence of fentanyl in our drug system right now, naloxone is going to work on a lot more overdoses than it would have previously. So what I tell people that come in is, even if you know for sure that it was a cocaine overdose, like the person uses cocaine, there's cocaine on the table, it's still worth trying naloxone because there has been fentanyl found in cocaine in the county and the whole country. And so it can reverse overdoses from a lot of different drugs that we are finding now because of the opioid content of them. But it does only work on opioids, and that is because what an opioid essentially does is too high a level of opioids in your system is going to depress your breathing, which is why the signs and symptoms of an overdose are going to look like lack of oxygen to the brain, because that's what's happening. So you're going to see blue fingertips, lips, or on a person of color, they could be ashy fingertips and lips. Really shallow breathing, non-responsiveness. We recommend doing a sternal rub if they are not responding at all, because it's uncomfortable. We also, obviously, if you're walking up to somebody you don't know on the street, you want to announce yourself first, try to get their attention. The sternal rub is what you're going to go to if they're not responding at all to that vocal stimulus. The most important thing to though is to call 911 as soon as you believe that you are seeing an overdose, because there's a couple reasons. It can take more than a couple doses of Narcan to revive someone. You're probably only going to have 1, maybe 2 on you, and so you're going to want EMS on their way because they're going to have more. In addition to that, as soon as the naloxone does work to reverse the opioid overdose, the person is going to be in withdrawal.
Oh.
And so immediately. And so they're going to be very uncomfortable, they're going to be very sick, and they're going to be very upset. And so we want everyone to be protected. We want EMS, law enforcement to be on their way so that they can help that person. Also, withdrawal is dangerous for a lot of people, so they're going to need medical attention. And so you want to make sure that you have them on their way. Ideally, if there's someone else in the room with you, you would tell them to call 911 and you administer naloxone so that we can work as quickly as possible. But if it's just you, you want to call 911 first. We're going to check the airway because lack of oxygen to the brain is what an overdose is. You want to make sure that they're first not just something blocking that. But in addition to that, once the naloxone hits their system, they're going to take a deep breath because their breathing has been breathed. You don't want them to inhale something that is lodged in there, causing further issues. In addition to that, they can start vomiting as soon as the naloxone hits because they're in withdrawal. In addition to that, that's why we're going to want people to roll them into the recovery position on their side before giving them naloxone if they are flat on their back. So some people, when they overdose, they could be slumped forward, sitting up on a desk. You don't necessarily need to move that person then, because if they vomit, there's no chance they could aspirate it. They're just going to vomit. So you just want to make sure they're either on their side or forward, head tipped forward. And then, like I said, all you're going to do is push this up as far as you can into the nostril. Push it up. I say wait for 10 seconds. The medicine's probably going to be out in 2, but we just better safe than sorry here. Pull it out, and then if you can wait 30 to 60 seconds. If the person is still non-responsive, you can get out another one, switch nostrils, and put it in that nostril. And the reason we ask people to switch nostrils is people can have blockages for all kinds of reasons. In addition to that, though, people that use drugs via snorting can damage their mucous membranes, and so they can have one nostril that is more receptive to being able to absorb that medication than the other. So we want to give the best shot of that medication getting into their system. And then you can keep giving as many doses as you have. There is no limit on the amount of dosing you can give. We have had people require upwards of 8. Because of the potency of fentanyl, we're seeing people need higher and higher dosages to the point that they are making 8 milligram sprays now, not for public distribution, but medically, because they're just requiring more and more. Xylazine, which has been found within the drug supply all over the nation, does make naloxone less effective, therefore sometimes requiring more because of that as well. So storage, you asked about storage. A lot of people ask us if they can keep it in their car, the glove compartment. We do not recommend keeping it in your car because we don't want it exposed to extreme temperatures on either end. If it does get frozen, if you leave it in your car and it freezes, it can be defrosted and used. It's perfectly fine. The heat is the more damaging, but the most damaging is sunlight. And that's why it's in an opaque box. So I recommend, the box is kind of bulky, but you can take out the little blister packs with the Narcan, and you can put them inside like an opaque makeup bag or something like that, and then put it in your purse or put it in your backpack. That's perfectly fine. If you can carry it on you, that's what we really want people to do, because you just never know where you're gonna come across an overdose, and it's probably not going to be while you're driving. It's probably gonna be while you're walking, while you're in a public restroom, a restaurant, something like that. I know Chrissy saw a presenter that said the only place she ever had to reverse an overdose was in an airport bathroom. And so she happened to have it on her. Those kind of places are where you're more likely to come across it. So if you can carry it on you, that's the best chance you have of potentially saving someone's life. If it is stored correctly, studies show that it is good for 30 years past the expiration date.
Wow.
30 years?
30 years, yes, which is honestly incredible. So yeah, they tested a whole bunch of naloxone a couple years ago from various emergency departments that had it stored, and it was 30 years old, and 86% of it passed the requirements, the current requirements. So it was still fully functional. And the other percent was just barely under the requirements, which means it would probably still work. So even if it's expired, we want to try it. If you think it's an overdose, it's worth trying. In addition to that, if it's not an overdose, it's going to do nothing. So there is no downside to trying it. If it's not an overdose, if for some reason it's a heart attack or some other kind of medical event, it's just not going to do anything. Because all it does is it's an opioid antagonist. So all it's going to do is, in your brain, you have your opioid receptors, opioids bind to those. So Narcan or naloxone just comes in and knocks that off and rebinds. So it rebinds for 30 to 60 minutes, temporarily blocking those opioids from binding, which is why it puts you into immediate withdrawal. But the opioids are still floating, which is why they can re-OD after the naloxone wears off, depending on the amount of opioid they have in their body. Again, why calling 911 is so important, while having medical personnel on their way so that they can watch the person, especially with just the potency of drugs right now.
In the event that the person who is down has a nasal injury, is there an alternative way to administer this drug?
There is intramuscular. That's how it was previously administered for a really long time. Obviously, we don't give that out at the health department. To most lay people, it's just not really an easy. This is so easy to use. So there is another way, yes.
But this is where EMS would.
Yes, exactly. I am not familiar on if EMS still carries the intramuscular, but I would guess that yes, it's probably.
I'm sure they would, yeah.
And there's no way to get this into a syringe to give it.
That medicine? No.
No.
No, yeah, it's just a nasal spray. Very similar mechanism to like a saline nasal spray that you would use when you're sick.
And it uses a mucous membrane to be absorbed.
Yes.
You cannot give this orally.
No. No. Yes. And on that note, it can be used on dogs and cats.
Dogs?
So, yeah.
Accidental ingestion.
So, that was,
on the table, on the floor.
well, if you drop a pill,
Yeah.
especially old people often, when you're opening medication, you could easily drop the bottle, pills roll on the floor. Some dogs will just immediately, if you have a lab or a beagle, immediately eat whatever's on the floor. And if that dog is 10 pounds and it eats, a couple Vicodin, there's a good possibility something could happen. So yeah, it can be used on cats and dogs, which is my favorite fun fact. And children, yes. So there is no age, minimum age requirement or limit on this. It can be used on anyone because it is so safe. So it can be used on children as well. Basically, if it has a nose, It can be used.
Oh, no, because it could, the chemical probably burn.
Your training, your
People's-
Narcan
it's something
training
called
is
that corny.
from what age?
Yeah.
Any age.
So if we wanted to get a 14-year-old trained in
Yeah.
Narcan?
Yes.
Okay.
Anybody, any age can come in and be trained. There is no minimum age requirement in the state of Illinois. I am not sure about every state, but in the state of Illinois, there is no minimum age requirement. I do personally know people who have trained their children because they personally are in long-term recovery and they just felt it was better that their children knew in case something happened, how to administer it. So, yeah, we can train anybody. And we also give out on the naloxone access points flyer there is the contact information for Live for Lolly, which is a nonprofit that we work with. There's 3 different people listed there that work within McHenry County, and they can help guide people to recovery services, just peer support. They do pretty much everything. So I like to let people know that that information is right there. It's going home with them. So if they want to contact those people later on to get more supports. I also have recovery information that I can give people. But a lot of times, people feel more comfortable talking to the people from Live for Lolly. They have lived-in experience, and they are really, really good at talking to people and meeting them where they're at in their recovery journey. And so they're really great at helping them. We also work with WarpCore, which is here in the square in Woodstock. And both those places also hand out naloxone as well.
Those are extra. Those are extra.
Does anybody else?
It's very useful.
Oh, yes. There's a flap on the box too that has instructions. All different kinds of naloxone is going to come with instructions. So sometimes it's a flap on the box and sometimes it's a pamphlet in the box, sometimes it's both. So there's extra instructions. I know especially when people come into the health department, I'm giving them all kinds of information in about 10-15 minutes. And it's just impossible to remember all of that, which is why I give them some information to take home and remind them that there's more information in here. They can also go to the Narcan website. They can watch videos if they feel that they need more training or they're interested in having more information.
I just have a question. Do you guys do like outreaches where, because I was thinking like my friend owns a bar restaurant, if he wanted like you guys to come in and train his employees, like is that something that can be set up?
We can, and also Live for Lolly does as well.
Oh, okay, all right.
Yeah, they do trainings. They were doing regular trainings at the Mental Health Board in Crystal Lake, and they're working on setting something up for this year too, but they do group trainings too where they will come out to you. I'm more than happy to also do group trainings, so for sure we have a variety of people who could help with that.
We're also implementing our school nurse conference back up. We're starting that back up again. Every year we do a school nurse conference and we stopped during COVID. So our first one is this February and it's completely around the opioid crisis. So we have a sheriff from Lake County who's going to be coming over to do a presentation to all the school nurses on what it looks like, how to identify those kinds of things. Live for Lolly is going to do a portion of the presentation. And of course, Taylor's going to provide the naloxone training along with the naloxone for them to take back to their schools.
I have a little bit of a concern with the potential for an unruly patient following the administration of this. Now, my experience with Narcan is with heroin patients. So it's pre-fentanyl. When we would administer this, the patient just really wasn't happy that we were giving them Narcan and coming out of it.
Yeah.
And if they have a tendency of violence or abuse, they would act out. And I just don't know if that part of it is being shared with the general public, who intends to do very well and help out. But when it's administered, there is a potential for a reaction from that patient.
That is something I always make sure that I mention, is that being in withdrawal, they could be combative upon waking up. And so that's a big reason that I stress that they need to call 911 immediately, because you want to get people on their way. because you don't know what the response is going to be. Even if it's, your own child, or if it's someone you don't know how that person is going to react when they wake up, because they're going to feel awful. And they're probably going to be mad that you took away their high.
Correct.
Because that is essentially what you're doing. You're putting them into immediate withdrawal. And so that is a real thing that happens, and that is a big reason that calling 911 first as quickly as possible is so important.
And law enforcement and EMS most likely will not be there before this takes effect. This is almost
Yes.
instant when it takes
Yes.
effect.
Yeah.
So you could have a person that's aggressive.
Yes.
Okay.
It is possible.
Lock yourself in the car.
Yeah, I was gonna say Kung Fu enabled anytime, be ready for that.
Yeah.
It just becomes gently, it's your fault.
They're generally not happy.
Do we have data on how many overdose we prevented due to Narcan?
So that data is really hard to collect because especially within the community of people who use drugs, they will sometimes reverse an overdose and never call 911, never contact EMS. And then also the documentation methods. I mean, EMS is very good at documenting it, but the police have a different way of documenting it. Not everything talks, and so that's kind of something that they're still working on. The CDC is putting out a real-time opioid overdose tracker that's going to track non-fatal. We'll see how that works. None of us know, so I'm hopeful that would be great information to know, because currently, tracking deaths is one thing, but tracking people who have overdosed and lived is great information to have for especially what I do.
Can you, I had to look it up, but can you explain the sternal rub?
Yes, sorry. So a sternal rub is you're just going to make a fist, and on their sternum, so in the middle here, you're just going to rub hard. And basically, if you do it to yourself, it's uncomfortable. It's not painful, but it doesn't feel great. And so if somebody's not responding to that, they're
Just
not
slap them
responsive.
feet.
If they were just asleep or very high and nodded off, they're going to grumble. They're going to say, go away, leave me alone. If they're cognizant enough to say, go away, leave me alone, they're not overdosing. And so you can leave them alone. That would be my suggestion if somebody's yelling that at you.
So to that point though, I mean, I guess, because I've not been around someone, so if they say, go away, leave me alone, are you sure they're not overdosing and it's just gonna happen after you walk away?
There's no way of predicting that.
I mean, like, they're in the
Would we rather
beginning
just call
start of it.
911
Yes.
anyway in
Yes.
that case? Yeah, I would.
Yes.
Let them sort it out.
Yeah. If you-
Regardless of take that action.
Exactly. I mean, you can make the distinction on if you feel like they are in a situation that calling 911 is worth it. Yes, I've definitely call 911 in that situation.
Assuming they just took it and it wasn't reacting enough fast enough, that happened within the 5
Yeah.
seconds of walking away.
Yeah, instead of walking away and leaving them, that's a perfectly fine response. But they're not technically overdosing at that moment if they are cognizant enough to respond to you.
Thank you very much.
Good stuff.
Thank you.
No, all of those are yours to keep.
Oh, I filled it out.
Yeah,
Like
I filled it out too. I
said,
thought she needed it.
I hand out the other two, but you can take the checklist home too if you want to remember what I said. We also, forgot to mention this, we also do hand out fentanyl test strips and instructions. These we only hand out if people ask for them because we get the Narcan free from the state, but these are not currently free from the state. So there's instructions on how to test your drugs for fentanyl. These we don't give out quite as often, but occasionally we do get people that ask for them. So this is something else that we have as well.
We had a dad come in who found something in his son's room. And so he asked if we had those because he wanted to test them.
Interesting.
He wanted to test his kids' drugs to show his kids
But this
what
is-
he was getting into,
Catch
which
you
is,
that.
I think, a very good test strip.
I would've just.
Kids are not going in and saying, I want to
to
test, yeah.
So that is who it's
Users
directed
also,
at.
yeah.
It is directed at users to test their own drugs.
I know, it's slippery slope.
I don't know how often they're being used. That's a hard thing to call. Then that's why we only hand them out if someone asks, because it is a hard call on whether it's actually gonna get used or not.
Can I have one?
Yes.
I just want to have it
Yeah, I
available
actually
at
would-
my center.
Yeah, do you mind
so
if I
they-
have one too?
People know they exist.
I only have 2 with me.
Thank you.
Yeah. And if you can get, for your center,
I'll put it at
if
the
you
restaurant.
contact Live for Lolly, they
Yeah.
can probably get you.
Right on the
some
front.
more.
Yeah.
Just
Yeah,
put it
because I
up
know
so
that they
we
have
can
a
do some
whole-
sort of training
They
here.
order more than.
I almost needed that when I ordered a
I
samosa
think they'd be
chat.
surprised.
Thank you so
I think
It was so
kids
freaking
will
spicy, I
test.
couldn't eat
They
it.
should have told me that. I would make sure
If we-
Cindy's under Cindy's notes, I'm gonna put like,
It
did
was
not
on,
put spice
I gave
in
it,
there.
I took one bite, I gave it to Mark.
Oh, you did? Well, he would have eaten it
It was
anyway.
good,
He
it
likes
was
that
good,
stuff.
yeah, I know, it was good.
Well, I was
Well,
gonna
thank
say,
you.
Nick, yeah,
Thank you.
Nick.
Any other questions?
Yeah.
Thanks again, thanks.
Thank you.
So we're on to new and unfinished business, and the first item is a resolution authorizing compensation for bilingual staff in the Department of Health fiscal year 2023 budget 51. The Finance Committee had 2 meetings, and Kyle had sent me an email I'd like to read to you first before we go into the presentation itself. Just because he couldn't be here, you were at the meeting, correct?
I was.
Okay, if you see anything, it's just a brief overview of his opinion of how the meeting went. If I say anything that's different, then you can correct me. I just want to read it into the minutes from the Finance Committee. I think he tried to reach out to you. Did he ever get a hold of you?
Yes.
Oh, do you want to do it?
No, go ahead, read. He said he was going to email something.
Okay. So, in short, the Finance Committee had 2 meetings on the topic. In the first meeting, there was a handful of questions and concerns about the implementation and structure of the program. We're going to hear more about that a little bit. In particular, the committee felt that the initial 5% and 3% stipends were not egalitarian as a flat dollar amount, as a flat dollar amount, owing to the large differences in pay between employee grades. As such, we recommend, this is the Finance Committee, recommended a flat dollar amount of $3,000 and $1,500. At the second meeting, Susan had answered a bunch of questions that had bubbled up at the first meeting and done a cost analysis, and we're going to hear more about that. Bottom line is, after speaking with Melissa, you guys have done the legal work on bringing this forward because it's been happening in another department, right?
I wouldn't say it's the legal side, but we've been working
A
with
resolution.
county HR, yeah.
A resolution?
Yes.
Mhm, okay. And that the county HR and finance have given their blessing?
It's been reviewed, yes.
Okay. This resolution will cement the expectation of bilingual service in McHenry County Department of Health, set minimum standards for such competency, save the county money versus a language line, and show appreciation to our employees who have this ability and additional capability. In summary, the Finance Committee recommends that the Board of Health approves the resolution authorizing compensation for bilingual staff in the Department's Health fiscal year 2023 budget. So that was from Kyle. So if we can segue into 9A, and who is going to lead off on that?
Well, I don't know if we want to just recap maybe a little bit, Susan, for the folks who are new. We can add some additional, we can respond to questions if they're still outstanding, but again, this is something that we have a skill set that we are utilizing with our staff. We have a growing refugee, immigrant, and migrant population, so we utilize our Spanish-speaking staff every single day, and we really need them positioned, and we have them in each of our divisions, right? Because we get a phone call to operationally and from a program service perspective, this is an essential service that we're providing. it's essential that we are meeting the needs of our residents and able to communicate with them in their language. The language line itself is something that we can tap into for languages other than Spanish, for example, that we don't maybe have on staff. I think lately, and Susan can speak more to this, Ukrainian, right? So that's not something that we have a skill set. We can tap the language line for that. But the language line isn't really intended for long conversations. It's really intended to capture information. It's very expensive to use. Our staff have been performing these skills for a long time, and we feel they deserve to be compensated. Other counties also compensate their staff for these skills. And if you look at, so the spreadsheet, which I don't think we included in the packet this time, but the proposal as it stands now is $68,902 for the staff that we have listed who are currently on staff. Actually, I think it may be slightly lower, but that's with everybody included, because I think we have one staff person who, forgot, Susan, were we taking that person off? No, we're retaining that.
We adjusted to who would require, or we took off the supervision. The coordinators were on the original, and after further discussion, we felt like the frontline staff is really what's essential and mandated in certain situations, so we removed the supervisors from that. So it reduced it from like 78,000 to about 68,000.
And for comparison, so the court, so I reached out to the courts, that's who actually has the language line for the county, and they actually have 3 bilingual staff employed over there. Their structure is very different. So they position somebody in the courthouse all day long to do that bilingual interpretation. We don't have the ability to do that. We are taking in phone calls, we are seeing people at the front desk, we have different disciplines that people have to be trained in. So, but I'm gonna just, as a comparison, as something to look at, the interpreter position is a grade 4. So that minimum salary is $40,000, just over $40,000. And fringe costs right now with health insurance, or health insurance is roughly $28,000. So it's very close, $68,575. Let's say estimated for one employee to do that work full time, which again would not be an efficient way for us to do our jobs, versus $68,902, which is our estimated cost to do the stipend. And that assumes that everybody takes the test, everybody meets the competency, everyone that we're expecting to test. Pam, I think you had a question.
I know that because I'm unbelievably analytical. I mean, I think it's a phenomenal idea. The question I think that people will have is, how do you evaluate its effectiveness, right? So I can see people saying, okay, maybe we'll try it, see how, but how are we going to measure that? So we absolutely come back. You can sell it as a pilot. You can do those things. How do we measure its effectiveness? So on year 2, year 3, year 4, it's a non-issue because we've got data that supports the fact that this is a good program and it's more than effective.
So, I mean, Susan can talk in detail to this, but they have, every division was asked to track their Spanish speakers to how many calls are we taking in, how much time are we spending?
I'm just saying, and you and I have had this conversation, I just think that that's extraordinarily important as you go forward and you say we're going to do this, that not only have we already done the groundwork, but you're going to measure that effectiveness as you go on. People who are number-oriented and policy-oriented want that kind of information.
So I'll let Susan expound, I think she's...
Yeah, I mean, and I think that's why we, you know, by using the ARPA funds, it gives us those 3 years to collect that data so that we can come back and say, you know, this is working and we need to continue this. And then if we don't have the data, then we have to make that decision on what to do.
But I'm just saying, you know, when you're trying something that's new, you answer all the questions before the questions are asked. Mine would be is we already know that we're going to use ARPA money, we're going to do it for 3 years, we're going to have data, and this is how we're going to collect that data, and this is what we're going to ask people, and this is how it's going to come back and be presented to you. I'm yawning by the time you get to the end of it. You know what I mean? It's a comfort level. You've done your homework, there it is, here's what we're gonna do.
And we're already working, I mean, we started, like you said, that groundwork
Yeah.
data, and now we're gonna, if this moves, you know, if we get this passed through, yes, that data is gonna be continually collected, the efficiency of using our own staff versus language line, all that kind of data will be collected.
And just to reinforce, it is stated in the resolution, but everybody has to meet the competency.
Well, my question would be, and it was one I brought up, and is this a blanket for anyone to test and take and receive the bonus? Or do we have a number of staff? That was a question I was concerned. And what does that flow chart look like? I mean, when the calls come in.
So, every division director identified the staff in their division who we need right now and who we have on staff, who we believe would meet the competency. So that is 21 people.
Right, but what I'm saying is 21 people needed? Is 15 people needed? What is the number that is?
I think we're utilizing all these people now.
Okay, so then
But over time, that number may.
how do you structure it so the next person that comes in that's bilingual doesn't say, I want to test for this and get that bump? How is
Well,
that?
we have also identified positions, right? So not just people, but positions.
Right,
So my initial reaction would be by right, we have key positions, we have
Okay.
frontline staff who are picking up the phone, key positions that are doing direct service with the patients. We have some nurses, we have folks in CD, so they have to be able to communicate and interview. I don't know if Susan.
But I get what you're saying.
Right.
So you'd have to specify that it is limited to these positions, and we only have X amount of available funds, if that's what you're looking for.
well, yeah, and you're
Not
gonna put that, I think we talked about it, and I'm just making sure we
Yeah.
don't get clear on it, but you're gonna put that in the job description.
Right, we are going to, so we have been reviewing job descriptions, so it's going to say, now, we have talked about this where we didn't want to say must be bilingual, right? Because then potentially, if we cannot find somebody to fill that position, that's going to keep us, it's not gonna give us the flexibility to fill that position, but we will have to obviously pivot if we currently have a bilingual person in a position and we ideally want to replace, let's say that person resigns, moves on, retires, whatever, replace that person with a bilingual person, but if we cannot find that person, then we are going to have to adjust operations a little bit.
Right, but you're gonna put it in as, the regular job description as
Yep.
it is in a step up would be the bilingual part, correct?
It's not going to be a separate grade.
Okay,
It is going to be a stipend. That
Okay.
stipend makes it easier for us to budget.
okay.
And back to Kyle's concern with a percentage, it won't change the grade. It's just going to be a flat stipend for that work.
And then, I hate to bring this up, well, it's gonna come up. What other languages would people potentially up for discussion when someone becomes an employee and says, well, I speak fluent Ukrainian?
So
Are you
I think
going
we're, and I saw Susan raise her hand.
She's climbing out of the chair.
She's.
Go ahead.
Hold him back.
Well, to go back to the other point, I mean, we have identified all the positions that we would prefer to be bilingual in Spanish because of what they do and the number of people they come in contact in a day. We do have that data.
Oh, good, okay.
Okay? So currently, those positions are filled with bilingual staff. A couple are not, but so we'll be updating the job description to say bilingual preferred. If they're Spanish, we'll test them for competency. If they pass that competency, then of course we'll provide them the stipend. If we can't fill the position, we're still gonna have to pay for them to use the language line. So it's going to cost, no matter what, our positions are. So we have, ideally, we wanna fill it with the bilingual, but if we can't, we're gonna have to pull from other staff to help them, or they're gonna have to use the language line,
Right.
which is far more expensive. As far as the Ukrainian.
Oh, I
if
just
some-
use that as an example, but somebody else that might come in and say, am I eligible?
Well, we have, we do have people, we do have some staff that speak Polish, Cantonese. So we do have people that do speak other languages that we typically don't see necessarily coming through our doors. Right now, we are seeing the Ukrainian population come in, and we are using the language line quite a bit for that. We're having a lot of Mandarin come through our door lately, so we're using the interpretation line for that. If we happen to get somebody that does speak that applies, and they pass the competency, we would use them, and we would not provide them with a stipend because we don't have enough volume of that at this point. I don't think to determine, just like we do the Spanish. But my proposal is in the resolution that we would pay them the rate we would pay the contract language line that we would have. So instead of paying the contractor, we're paying our employee to do that.
And back to data, right? So by utilizing ARPA, it gives us the time to also, over these years, so we're collecting data all the time, not just about this, but about the demographics of our community. So as that changes, or as our service needs change and languages change, we would essentially be collecting that information and understand, yes, our demographics have changed, and now we have, 5% of some other demographic that we have to serve in another language, and we may want to look at providing the stipend should we have a staff member. But that would be information we can bring back and report out on based on the needs.
Right, no, I was just, I'm all for it, I think everyone is, I was just, it's gotta go before the board, and so it's better to have it all buttoned up. If we're confused about it, then,
I think one way to put it is we're not giving a stipend for being bilingual or knowing 2 languages. We're giving a stipend for a skill set that's being used, right? And that would be the language, Spanish language, or other languages that come about. But it's not so much, if we want to present it as it's not so much being bilingual, it's if you're going to utilize this skill, then, that would be something else to look at, that they're getting a stipend for utilizing their Spanish language, then that Spanish language must be utilized. So it's a skill
thank you.
set.
No, I agree.
Yeah.
Joe?
What I would like to ask the chair to request is that this topic, someone make a motion, let's get it seconded. What I'm going to ask the board to do is, I can't do until it's been motioned and seconded.
I'll make a motion
discussion.
to approve the resolution as presented.
And I'll second.
Discussion.
Okay. Anybody else got discussion? As I see it, the staff has made a good presentation to the Finance Committee. The Finance Committee has determined that there's a need. They've set some rates for interpretation and translation and for the total dollar amount, et cetera, et cetera. The Finance Committee has done their role in establishing the finances of it. As far as how it's going to be implemented and how the language is going to affect employees and when employees get affected, I am going to offer to the board that this matter be referred to the Personnel Committee for further review. It requires a second and then action.
Okay, do we have a second?
I'll second it.
Okay, let's have some discussion on that.
Okay. The reason I would refer it to the Personnel Committee, because it's related to personnel and how they are going to be recognized for their talents, how it's going to be paid out, how it's going to be prorated when necessary, what's the impact, if any, on other benefits that employees may receive, healthcare, workers' compensation, pension, so that it can be further discussed at the committee level instead of doing it here at the board level and becoming a prolonged discussion on one item at the board meeting.
So what you're proposing is, after it's been through the Finance Committee, to go through your committee and come back and then vote on it?
Correct.
Okay.
Yeah, I'll just throw out some questions I have is, Is it pensionable? Does it impact?
Of course it would be, it's part of their salary,
Yep, and
stipend
that's
or not.
included in our proposed costs.
Yeah.
It's already been accounted.
Is it impact workers' compensation rates? Are you going to pay it out on each paycheck? Or are you going to make it an annual stipend?
I think
Are you-
it would be 20, divided by 26 paychecks. So if somebody leaves, right? So they're getting that amount divided
There are
over.
other options to implement that.
Okay.
And that's what I think should be discussed at the Personnel Committee.
If it makes it easier, I'll withdraw my motion and go ahead and let.
Although it has to, referral committee has to come after the items on the table.
Oh, okay.
Yeah.
But I can still withdraw the motion.
Oh, yeah, you can.
Yeah, so I'm
But then I
supporting.
can't refer it to committee.
You actually have to vote on it before you refer it to committee?
No, not vote on it. I'm offering as a substitute that it be referred to committee. That would be voted on first. If that fails, then it goes back to voting on the main motion.
Okay.
That's how I think it
So
goes.
the only concern I
I won't
have
argue.
is that are we, by going to the personnel committee and not voting on it tonight, are we just, these people are working extra and doing all this, and we're just delaying when they're gonna get paid? That's my concern.
It's gotta go to the board though, too.
It does have to go to the county board, so
Okay.
I guess I would respectfully request that we then have to schedule a personnel committee and a subsequent maybe special board meeting. Otherwise, the next Public Health and Community Services meeting is February 2nd. We do, hold on, I need to look at the calendar. So there would be one more, is there one more board meeting in there before the county board meeting?
I would respond that this is not emergency action.
Okay.
That this can take a month or two before it is implemented.
Okay.
That's my opinion. And the employees that are affected will be compensated.
Retro the first of the year.
Well,
We can-
whatever's decided,
however,
but
right.
it'll.
Yeah, that's not currently actually,
I think
it's
that-
not currently addressed in the resolution, but that could be part of the conversation.
Correct.
But this is an annual stipend in the
It
resolution.
would be an annual stipend in the resolution, so, but it's a good point, actually. It's I think, an oversight on our part to address when it would start. So retro to either December, right, on a fiscal year, because the county's on the fiscal year versus the calendar year.
No, I would just like it done. I mean, as someone who speaks Spanish, and, you know, knowing that this is, that, you know, I would hate this to be delayed to compensate those people. Because one thing I don't know if it's in the data is, because, you know, when I can speak Spanish and I am talking to my patient, boom, boom, boom. But, like, I had a patient who spoke French, and I had called the interpreter line. That call took an hour when it should only took 20 minutes. So that's 40 minutes of extra of my time, and how much the loss of you know, of county time. And I'm wondering if that can be, you know, if showing like.
Quantitated,
so
Yeah,
maybe-
and we didn't, so,
Saving.
sorry, apologies if, we did have new people, but because we've had several meetings, we provided information, we can provide all of it together, you know, to show sort of that series of progression of the information that we've provided. We just keep iterating on the process and providing the next part of the information, which would have been the resolution, versus going back and providing all the original backup documentation, which we had, you know, about how many people, the length of time those calls are taking, and then a comparison of what it would cost if it was.
Well, if you're,
counted the language
now, if you're thinking that you're going to need to make changes to the resolution, then it does need to go to the person.
Well, it doesn't, but that can be changed, you know, with, the board could say, yes, add retroactive to December. There's time to change that before it goes to public health. So we have time, or if we are just, you know, we'd have to decide when are we calling a personnel committee, if it's going to personnel. And then what I heard Mr. Clark say is it could wait till the next board meeting. I don't want to put words in his mouth,
Right.
versus scheduling a special meeting, in which case our next board meeting is the 20th, so it would, could potentially stay on our original timeline. The county board meeting is the 21st. But we would not have the ability to make any changes at that time. Because it would, that meeting is going to post, is ours on the 20th, are you sure? Or, no, that's President's Day, so the 13th is our meeting? Does that sound right? No, that's Lincoln's birthday.
I would suggest
No,
that
but I think
you
that
set,
was the 20th, I thought it was.
Okay, yeah.
I would suggest you set a goal to have it ready for the March meeting. And if we get it done in time for the February meeting, all the better, we'll get it done.
Well,
But
can,
set it up for the March
we have
meeting.
no food in here, we're starving. Can we, here's another thought, can we as a board approve the resolution pending the approval from the finance, from the personnel committee?
That would require amending the main motion, reconsidering the main motion.
And I'm uncomfortable with that. There's
Okay.
a lot of stuff there. I wouldn't
Okay.
want to do that.
I just thrown that out there, that's fine. Can we try to get it done by the time frame within the 20th if possible?
We'll try, but I would set the goal
Well,
to have it
so-
done by March, so that the employees and staff recognizes that.
Yeah,
that-
actually, I'm sorry to interrupt you. Because it has to go to public health, the order matters. So, from here, if it was approved, it would go to public health on the 2nd. So if it's going to the Board of Health, then it needs to go to public health, which would be March 2nd. Would be the soonest it would start the county process.
Well, then, let,
I think as long as they get retro, just because
right.
I think, us not doing due diligence and getting this done, they should still be compensated.
Yeah, so that's an easy thing for us to add into the resolution the next time we bring it back. And then determine what other information is outstanding, aside from anything that Mr. Clark has already brought up.
Was this someone, did he need something?
I have no idea.
That's a secret.
You want me to ask?
So, table the motion?
No, I'm calling the question. We're gonna take a vote on
Okay.
sending it back to committee. I got that, Joe.
All right, all right. We rephrase, we repeat your motion, so we are clear.
I move that we amend the main motion by referring this to the Personnel Committee.
And did we have a second on that?
It was Jay.
Okay. All right. Any further discussion? Darlene?
Ms. Carmen?
What?
We should wait until Barb gets back,
No.
because she's got to vote.
You can talk slow. Miss Carmen. Mary Ellen's got a Wrangler. Go away.
He just wanted to let us know that he was leaving, but all doors will lock behind you.
Go out the left side of the door downstairs.
We can go out any door, they'll lock behind us.
All right, so we're taking a roll call vote for the
To send it
motion
to
that
committee.
Joe put forth and was seconded by Jay to have the resolution go to Personnel Committee. Okay. Darlene?
Ms. Carmen?
Yes.
Ms. Ortiz?
Yes.
Dr. Amsler?
Yes.
Dr. McGuire?
Yes.
Mr. Galati?
Yes.
Mr. Clark?
Yes.
Ms. Altough?
Yes.
Ms. Gaffney?
Yes. Now we have your motion on the floor.
As amended by the emotion that we just took.
Correct, so that once that's approved.
So it's done.
It's gone. It's done.
Okay, all right. So where does that leave us with B? We
No,
had
you
C,
added
we had
C,
C,
9C
we had
was-
9C,
yeah, you
add
moved
pending
9C.
this.
So we could talk about 9B and then go to 9C.
And we'll table 9C.
Yeah, I would suggest yes, because we would not enter into a contract with the language service until, one, the Board of Health approves the resolution, and then that would still be contingent. The entering the contract with the language service is contingent upon our resolution getting all the way through the county.
Okay, on to 9B. We have a resolution authorizing the emergency appropriation of $50,000 in additional grant funding from the Illinois Department of Public Health for the Illinois Breast and Cervical Cancer Program to the McHenry County Department of Health fiscal year '23.
Move to approve that resolution.
Do we have a second?
I'll second it.
Any discussion? Darlene?
Ms. Altough?
Yes.
Dr. Amsler?
Yes.
Mr. Galati?
Yes.
Mr. Clark?
Yes?
Dr. McGuire?
Yes.
Ms. Ortiz?
Yes.
Ms. Carmen?
Yes.
Ms. Gaffney?
Yes. We have executive session tonight. Any other board issues? Direct your attention to the thank you note for the nursing department for administering some COVID vaccines.
Yep, no more.
And the summer lunch program, thank you, that was very successful. Do we have a motion to move into executive session? For the purposes of discussing personnel issues.
Oh,
Correct.
okay.
Do we have a second?
And minute.
And minute approval.
I second that motion.
Okay. Going into executive session at 8:36. All right, we're back into regular session at 8:51 PM. Do we have a motion to approve the, pardon me?
Approve and release.
Oh, yeah. I couldn't hear what you're saying. Do we have a motion to approve and release the minutes from the executive session of November 21st, 2022?
So
Dr. Amsler,
I'll
yes?
second.
Thank you. Any discussion? No? Darlene?
Dr. McGuire?
Yes.
Mr. Clark?
Yes.
Ms. Carmen?
Yes.
Ms. Ortiz?
I was not here, I was sustained. On November 21st, right, yeah.
Dr. Amsler?
Yes.
Mr. Galati?
Yes.
Ms. Altough?
Yes.
Ms. Gaffney?
Yes. Okay, on to compensation package for the 4%. Do we have a motion?
Madam President, I move that we approve a 4% merit increase to Public Health Administrator Melissa Adamson, which will bring her annual base salary to $157,858.51.
Second.
Dr. Answer, second. Any discussion? Darlene?
Mr. Galati?
Yes.
Dr. Amsler?
Yes.
Ms. Ortiz?
Yes.
Ms. Carmen?
Yes.
Mr. Clark?
Yes.
Dr. McGuire?
Yes.
Ms. Altough?
Yes.
Ms. Gaffney?
Yes. Do you have a motion to adjourn?
Oh, yeah, man, I'm always there to adjourn. Yeah.
Second?
Second.
Dr. Answer, all in favor?
Aye.
Opposed? Meeting adjourned at 8:53. What's this, Joe? Oh,
Yes, I know.
you have a good pen. I have only a minute.
Yeah,
What?
no, she was looking for a pen, I said you have.
Oh,